Well, welcome everybody to another episode of our Pacific Set Continuum podcast. And I'm really happy to have the guest that we have today. We were talking about this before we got started. He has come so far in a short amount of time and basically just has, you know, followed the pack kind of on a path of trust. And I think he has a really great story. So stay tuned. But just want to introduce, we have Garrett Caldwell again, CEO of the Pacific Aesthetic Continuum and Core Dental Laboratory. And our special guest is Dr. Angelo Maniego, who is, I don't know, he's such a good guy and is such a great clinician now. And like myself, comes from a family of dentists. His mother's a dentist. And I think you just have a really cool story. So thank you for joining us.
Yeah, well, appreciate it, Dr. Misaki. A little bit about myself. I graduated in 23. I went to Rosen University, and then, prior to that, I was a dental assistant. I worked for Invisalign, those little jobs that we do. But in the end, it landed me back here in Sacramento. So that's where my mom practices in Roseville. Literally like a street away from Core Dental Lab, so which is great.
Wow.
And then that's where we met you, all the courses that you've been setting up. So, I joined the pack in 24 fall of 24, I
Cool.
believe, and that's when we started. That's the first time I did veneers. So, and then moving forward, I've just been taking the course ever since and just been doing more of these aesthetic cases. So, yeah, glad to be here.
That's cool. So it's only been like a year and a half, if that, that you've made all this change.
I guess
So
so.
yeah. So we cross paths at implant courses and we cross paths now at occlusion courses. And if we go back to the pack and the curriculum that the pack was stressing, and that was, when we get out of dental school, we're thinking basically one tooth at a time, maybe three teeth when we do a bridge. And now at the pack, we're thinking about multiple teeth, 10 teeth when you do an aesthetic case. And I know you've done upper and lower arch cases now. And so did you feel like the pack education kind of got you ready to do larger cases or made it where you felt comfortable doing larger cases? Because you're trailblazing ahead.
Well, I don't know about trailblazing, but I'm doing my best. So, number one, absolutely. I feel like, you don't, you won't really get to do any of these bigger cases unless you start, right? And that's the most important thing. And especially when I tell like my classmates or even the younger ones, you just got to start with one. And I think, the pack kind of helped me get a little bit more comfortable, selecting the right case, selecting the right patient, and then my first veneer case was a very minimal prep. I worked on a friend, that
Mhm.
she wanted veneers, and I'm like, all right, I'm taking the course. And then, I was very careful, a high school friend, right? Worked on her, everything's great, everything looked good, and then you kind of relay that information that you learn from the pack on your daily cases. So now, I approach different cases like, all right, well, before we even do this, we got to do, get your bite right. We got to remove all the disease. We can't just hop on and do the case, but, now, taking one, two, three, four, now we're doing more of the smile reconstruction case and not just minimal stuff. So, it's nice to kind of get an overview of how to do them. And then once you start doing more and more cases, obviously nothing's perfect, right? Nothing's perfect in life. What you're gonna have a veneer that pop off here and there, but that's what you learn from. Each case that you do, you're always gonna learn something new. Not everyone does the same thing the same too. Every doctor does things differently, but you pick little pieces from every faculty from this course, and then you kind of create your own, and then all of a sudden you have your own protocol. So I think that's one of the best things about joining the pack is everyone has a different approach. Pick and choose which one you like that works for you, and then just run with it. So
I think one of the things as I'm listening to you and I think about how far you've progressed as fast is that it gives me an appreciation that the PAC curriculum is actually pretty efficient, right? I mean, you didn't spend a lot of time having to study things. We just kind of get in there and we just start doing things. And like you mentioned, that's where you really learn. Because you can read one thing in a book or you can listen to a lecture, but when you get out there and you're actually doing it on a patient live, yeah, you're going to figure out that, okay, maybe I do want to have a nice bevel so that my restoration when I do cementation just sits on that tooth and it doesn't slide around. Or yeah, maybe I want to be sure that the bite's okay because, you just sometimes you just take care of the smile, you forget about the function, and you're absolutely right. That veneer may have a hard time staying on because you got some kind of interference over there. And
Yeah.
but we learn from each other, and that's one of the other cool things I think that I love about your story is that again, you're a really friendly guy, kind of outgoing, and everybody loved that in the classes that we've had. And I want to give everybody kind of a heads up on this too, that you've actually helped instruct other doctors now because you attended the course that you did where you were kind of the student doctor, and then you were able to take that information, actually start helping other doctors as they go through the courses. It's kind of that camaraderie because again, you could go through a course or you could take a class and you're not challenged to really integrate it, but you made great friends with everybody, like even Dr. Yazzie. And I think that the nice thing is you have this friendly way of kind of keeping on each other to push each other forward, right? So I don't know, th- was that different than dental school, or you're probably always a friendly guy, but
I I mean, dental school obviously a lot different, right? You have to meet the requirements of graduating. So, I mean, you have your group of friends, but then you also have the outside people. When it comes down to joining the course, number one, we might be neighbors. Like I have, other doctors around the area, but we just kind of we're all a separate entity in a way, like we're not in competition of each other, in terms of like, all right, who gets more patients in the area and things like that. I feel like we're all helping each other out, which is great. I remember one time when I ran out of cement, right?
yeah, yeah.
I have to cement I think a full arch case, and I ran out of light plus, and that's what I used from the upper arch. So obviously I got to match the bottom. And who did I call? I called you, I called Dr. Yazi, I called, everyone in the area, and all of a sudden I was able to pick some up. I mean, that's because if we order, it's going to take a while. But it's one of those things where it's like, hey, like we all help each other out. And if you have any questions, then we kind of share and relay information. And that's what's nice about the pack is even we meet these other doctors that are doing similar things, and then we're just going to grow together. Even joining, helping out in San Jose, I got to meet, I don't know how many doctors that are signed up in that area, and just helping them out. And then now we're all friends. Every time we see each other at the course, it's like, hey, it's like it's a family reunion, really. So
So let me ask you about that because there's two things I think doctors are concerned about when they think about taking a live patient course. One is working in front of other doctors, right? Because in a private practice, you may not have to ever do that. And then two is the cost of the course or the tuition. So do you have any advice on those two things? I don't know if you were nervous at all when you came in or not working clinically.
yeah, I mean, I'm always nervous. I'm nervous right now, but well, number one, it's, when you're nervous, you got to figure out why, right? It's because I haven't done it. So, the first time that I joined, I've never done it, and I'm working on a friend, and it's something new, something different that I haven't done in my day to day. So once you get off that hill of trying it and actually successfully doing it, then you get more comfortable. I signed the second course and I did same thing, uppercase. But then, now that I know the first step, the very minimal, then we're going more into like opening the bite or things like that. And then on the third course that I took, it was literally a smile reconstruction case. So each level of the pack course that I took, I kind of elevated myself in terms of like I got to pick and choose this. I got to do this. And then on the fourth one I did a full lower case. So like a little combination of the minimal, the opening the bite, a little bit more smile reconstruction cases, and then doing top and bottom kind of gets you more comfortable and having a better idea of how you're going to approach certain things. In between all those cases, I was doing some in the office too. So it's like when I do one in the course, I already have something lined up the following week or 2 weeks later, and bam, do it, and then I do it again. It's just repetition. It's just putting in the reps, and then each case, obviously. There's always a challenge, like whether it's going to be a shade issue, using different materials from zirconia to Emax, like on the back end, it's like, and or choosing the right cement or even bonding protocol, like out of all the cases I've had, and I had a conversation with this with a friend, I've only had one veneer pop off, which is
Mm.
the first one that I've ever done, and it was a lateral because she bit on like a sourdough or banh mi, which is already a hard tooth and is a very minimal prep, but everything else has been solid. Like, so what you guys are teaching at the pack is exactly what we need to do for our daily, cases, even just for single crown tooth. I think it's just everything just kind of builds on each other, and then it just gives you more confidence, and same thing. Now I could do it in my office, and I have two assistants working with me on the cementation because, I figured out like it's just easier for me to work that way. It's more efficient. You kind of come up with these things along the way. So overall, yeah, it definitely gave me more confidence to do more. I'm starting to take more photos. This is something that I need to get better at, is
Mm.
just taking the before and after photos so you can start, kind of presenting it to the case, to the patients. It's just it's a great, if you're a new grad and you're just starting, take one of these courses because number one, they didn't teach you this in dental school, number one. Like, like none of the stuff was in dental school at all. So, and this is kind of like the real life stuff that you're gonna deal with. So,
So did you feel like because you took the courses when you went back to work, like you were mentioned, you had more aesthetic cases that were there? Like, did taking the PAP courses give you the confidence to go back to your practice and say, oh yeah, you need veneers, I can do them for you?
I basically that's how I felt. After the course, as soon as after the course or even before that, I was really kind of filtering, what what type of patients are a good candidate for veneers, right? Number one, everyone could be a good candidate. Like it's not just a veneer, it's more of like, does anyone want to improve their smile?
Mm.
And then I approach it in that way, whether they're going to go through Invisalign first or we have to do other restorations. But in the end, we're leading towards like, I want to make sure they have the best smile. So
Mm.
my approach is like, I like to think arches, like, what we kind of discussed is like, I'm kind of getting, well, I'm not gonna say I'm bored, but it's tough working on one tooth at a time, to be honest. It's
Mm.
just like by the time I get to the other end, it's already like 10 years later. So,
Yeah.
like I like to present things to the patients like, hey, if you want to get all this stuff done, we could, but we gotta do this first. We gotta do this, and then we'll finish that. And that's kind of how I approach like my dentistry now, or at least try to. But I not everyone wants it, which is fine, but there are a lot of people that do. And if you offer it in your office, you don't have to send them out, then obviously you could do it yourself. So,
That's all great information. And then going back to the tuition, I mean, when you take the course, you found a way where it really didn't cost you anything to take the courses. I mean, I guess time out of the office, but the cost of the course, you were able to have that subsidized by the patients because the patients basically covered the cost of the course, right?
yeah, yeah. I mean, it seemed like it's a lot during the time,
Yeah.
but really, it's really not. I
Yeah.
mean, all right, what is the cost of one veneer in a regular office? What,
Mhm.
roughly, if you put it in Chat GPT, what is the cost of veneers in normally what between 1,700 to 2,000, higher, maybe a little bit there. If you do 10 units, multiply that. What,
Mhm.
let's say 2,000, right? 2,000 per tooth. That's 20,000. To do a full arch with 10 units with the course is what? Like a quarter the cost.
Yeah.
So number one, the patient, you just let them know, hey, you're getting a quarter of the cost of how you would be purchasing going somewhere else.
Mhm.
Two, you have like 10 doctors right behind you. You have the best lab in the area that could support you. And it's all communication, making sure everything's there. It's overall there's no one's gonna lose. It's more of like when I present it to my patients, when I take them to the course, is you're gonna get more bang for your buck when you join the course for me to take you because one, we're all watching, and yeah, you get kind of, like you said earlier, like when other doctors are watching, does it make you nervous? I mean, we do that in dental school. You got faculty looking at you, you got the other underclassmen watching you. I mean, yeah, and you got normal daily office, right?
Hmm.
You're working on patients. Who pops up? Doctor,
Hmm.
do you need can you do this in the other room, this and that? Everyone's already kind of distracting us in the beginning. So you kind of just get used to it. And you just, you kind of obviously walk through, the students that are watching, you walk them through, or I'm doing this, doing that, but just get in the zone, and it's part of the game, that you
Hmm.
can't get away from it. So
Yeah, I mean, we're not trying to be like dental school. No one's intimidating or anything like that.
yeah.
We're just trying to be collegial. We're colleagues. We're learning as we're watching the doctor work, and we're respectful of that too. So it gets to be fun. And I think it grows a lot of friendships. That's
Hmm.
what I like.
Exactly. Now, going back to, like the first case. Now, you know, the first case that I had was obviously the cost of the course.
Hmm.
But as I progressed, obviously the fees changed for myself and the patient, just because, I'm doing more and more. So it's not my first time. So then you could kind of play with that in terms of, but I say if you're a first patient student, just ask your patient to pay the lab fee, just pay for the course, because you're getting your education, you're giving a new patient their dream smile, and kind of go from there. So
Hmm.
Here you get to see 10 cases, do a case and see 10 other cases
yeah,
and spend 40 hours with a world-class doctor like Miyazaki. Tell your patient your lab fee for your 10 veneers is going to be $17,000, but I can have my team of world-class doctors do this with you where other doctors have a chance to observe. And
yeah,
that will cost you $5,000 per for the whole thing.
yeah, yeah, I
And
know.
look at the results you get. You have the best lab, the best instructors, and you still have a great year, still have your doctor with you right there.
Yeah, it's literally a steal, to be honest. Like that's what I said in the beginning. I thought it was pricey just because I didn't know, but my patient paid for it. But then
Yeah.
again, everything else is just it is a great deal. I'm honest. I make sure like I prep the facial first, and then the way that we were taught in the pack, and I'm flying, like, which is nice.
The program, we talk about doing a veneer, and then you sort of corrected Mike in a way and said, no, I'm not doing veneers. I'm doing comprehensive restorative dentistry finished aesthetically, which is
Exactly.
really the whole premise of our program. It's comprehensive restorative. It can be a crown or a cranier or a veneer. You picked the hardest case at the beginning. You did a minimal prep case, which is a harder case to do than
Yeah.
a more heavily prepped case, but a great way to start because obviously the patient that comes in and needs just a little bit, but that wants a new smile, those cases are a lot harder to do
Yeah.
than the case where it's a bombed out mouth,
Oh,
right?
absolutely. I know.
Now you know. Now you know what you don't know. And
Yeah.
I guess finally, we always say if you continue to take the PAC program multiple times, when you get to the point where you can teach it, that's when you really start getting traction in the office.
Yeah.
Whether you decide to teach or not after the third or fourth program, now when you have helped us in the courses and you're over the shoulder of another doctor taking the program, answering questions is really different because you're sitting there as now an instructor, really elevating your knowledge base because explaining it's much more difficult than solving it yourself, I think.
Yeah.
Hmm.
I think now as an instructor, you elevate yourself to a whole nother level
Yeah.
within your practice.
No, 100% agree. Well, that's the thing, you like you learn from your mistakes, like not every case is gonna be a straight shot. I did something wrong with this one. You jot it down. It's in that memory bank, or like as simple as everything looks good, but then the canine is sticking out a little bit, or the shade is slightly off. Try to figure out why, like, and then once you solve it, then it makes sense. So then your communication with the lab as because how the way I work is different from Dr. Misaki's works or Dr. Yazi, or we all have different the way we prep and how we do things. So once you figure that out and you have communication with the lab, then they'll kind of dial things in and make sure, oh, this is how he does it. This is how he does it. Boom, boom, boom. Then every case is going to be slam dunk. So, I'm just trying to do the reps here, and then, just making sure everything's on point, and then keep taking the course. And every time I join, like I said, like I learn something new. So this is where you get like the real deal life of like doing veneers when you're actually doing it, not doing it on the model.
Yeah. So your the cost of the education, you had that subsidized by the patient, and you're right. As you were going along the courses, you're feeling more confident, and that's what patients are paying for. They're not paying for the little piece of porcelain; they're paying for your experience. So then you were charging your patients more, so you were covering the cost of the course. You were making a little bit of money, and then when you went back to practice, you were doing cases that you probably would not have done if you didn't have that experience. So you really have pulled it all together, I think, in the way that we ideally look at this curriculum helping you out. So
Yeah, well, that's
congratulations.
why I thank you guys. Appreciate it. I mean, it makes dentistry more fun. You know, like you can only find certain things that you enjoy within dentistry, and I think, going the aesthetics route, like, I started learning implants from you, doing all these other things, but it's just, we pick and choose what we enjoy doing, and I think this is one of them. So, thank you.
No, no, thanks. You've been great. So I would say one that we are very proud of you and how far you've come and how fast you've come and just the dentist that you have become. So no, we're really proud, and I hope your mom understands that one of the things that maybe we don't express enough is how proud we are of our kids. And so I hope your mom tells you how proud she is, because I know she is, but
Yeah.
it doesn't always mean that we as parents deliver that message. But no, you've really become a very good clinician. You started off with all the trepidation, a fairly young dentist would have, and yet you were brave enough to kind of have the faith to keep going. I think you've become a leader amongst the other doctors that were kind of in your class, and everybody loves being around you and respects you. And no, I think, like you're saying, at this point in your career, you're already getting bored of single tooth dentistry. So, the sky's going to be the limit. It's going to be fun to see how far you go with this.
Well, I appreciate it. Yeah, thank you so much. Yeah, I mean, I think yes, my mom is proud, and I'm proud to be her son. Anyone that paves the way for us, obviously we're super thankful. It's just we're lucky, we're blessed. We're lucky that we're in this game and we enjoy it. And looking forward to the next stage of my career and everyone else around us, like everyone that's in the pack, because that's we're all here for everyone's support. So.
Isn't that refreshing to hear a doctor say, we're lucky to be in the game, we're lucky to be dentists, we're lucky to be able
Yeah.
to do this? That's very refreshing because there are a lot of docs out there that are very frustrated,
Yeah.
and it requires this journey in some way, shape, or form to get to that attitude, really.
Hmm. Yeah,
Yeah.
no, that's great. Well, I just want to say thank you very much for your time. And like now we're doing this fairly late at night. So I hope you have a chance to get some rest and get ready for tomorrow. Thank you
Okay.
very much, though. We appreciate it.
Now, thank you so much. Thank you, Dr. Misaki. Thank you, Garrett. And looking
Thank
forward to the
you for
next
coming on
course.
and sharing with us. Great, great to hear. Great update.
Appreciate it.
All right.
Thank you.
Thanks, Mike.
Thank you.